Thank you, Mr. Speaker. I really appreciate it. It's an honor to be here and talk about House Bill 457. This has been a 3-year-long collaboration, and some would call it quite complicated, but really it's very simple. I'm going to try to stick to that. It's about patient choice, patient accessibility, and patient safety. If you take those three things and you combine it with what our pharmacies do in our communities, you'll quickly understand what this bill is about. We have folks over the last 2 or 3 years that I've spoken to, stakeholders, the Hospital Association, the Medical Association, of course the Pharmacy Association, College of Rheumatology, U of L Health, UK. It could go on, that are in full support of this bill. The community pharmacy needs to be able to have a level playing field in Kentucky especially. Kentucky's a rural area that needs pharmacy, and we've seen how important they've been in the last couple of years. If you think about how quickly we were able to get involved with the testing and the vaccines and a lot of the other things that were needed for our people. We also met this past summer, just so you'll know how thorough we've been trying to be, with several senators, several representatives, informal work group, and we reviewed it again and felt good about where we're at. So that's how we got to today. It came through committee unanimously, and I want to read, I've marked out 4 or 5 paragraphs, and I'm sure you all are happy with that. But I do want to read a couple of paragraphs that will, I think, help you understand why this is needed. More than ever, Americans, we need access to essential health care providers. That includes access to safe, affordable prescription drugs from pharmacists they know and trust. However, multi-billion-dollar corporate middlemen, known as pharmacy benefit managers, or PBMs, are distorting the prescription drug market, driving up costs for patients, and pushing out local small business community pharmacists. 3 Fortune 500 PBMs. Let me say that again. 3 Fortune 500 PBMs. The 3 is more important than the Fortune 500, actually, but 3 have vertically integrated to the point where they are all owned by insurance companies, and they control 75% of all the market in the entire country. I laugh when somebody says, you can't tell a PBM what to do, you're messing with free market, and I tell them free market's been gone a long time when it comes to prescription drugs. You got 3 PBMs that are dictating every single thing. So this type of monopolistic, anti-competitive behavior has got to stop. The Federal Trade Commission has looked at it several times. I won't get into all that, but just a couple of weeks ago, I want to think it was Grassley that sent out a letter to the Federal Trade Commission and said, look, you got to look at this. So we're not the only ones to notice. Second paragraph and then a couple dittos, and I know we've got to go. PBMs are the largest and the most powerful companies you've never heard of. They're bigger and the best known. They're bigger than a lot of the best known brands. They're bigger than Exxon. They're bigger than Microsoft. But almost no one understands what they do or how they affect your drug coverage. They're classic middlemen who try to oversee the administration and try to take credit. So I could go on further with that, but I'm gonna hit a couple of high points, and then you guys, I am wide open to any of the questions that you guys want to ask. So let me see here. It requires pharmacy requirements to be imposed equally on all insureds. Again, some of this will make sense to some of you all, maybe not others, but it establishes contracting requirements for pharmacy benefit managers with pharmacies or pharmacists. It includes prohibition of retroactive denials of pharmacy claims. Our community pharmacies are filling medications, and at the end of the year, they're being asked to pay $300,000, $400,000, $500,000 clawback fees to these PBMs. This prohibits benefit managers from basing reimbursement for a prescription drug on outcome scores or metrics. There's a whole reason why that's ridiculous. PBMs will no longer be able to impose limits on pharmacies' access. I'm going to end with this part. I won't keep on going. This stops mandatory mail order. This is a big deal. Our rural communities are out there, and they won't bring their big box pharmacies over into our rural communities because they can't make money. It's about profits over patients. It always has been. I'm a capitalist, the biggest one you'll ever find. But you know what? One of the biggest capitalists the books I've read is Milton Friedman, and nobody ever wants to say the last part of his quote. Profits, 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 as long as you play by the rules. These guys have been playing by the rules a long time. It's time to stop it, and we won't have to. They won't come to our communities, they won't put in it, but they want to do a mandatory mail order. So if they won't build their pharmacy in our community, they say, well, we're going to get around that. We'll just make them mail order to North Carolina. So we take all our money and send it out of state. Even our own state employee plan makes our state employees send their prescriptions out of state. It just doesn't make any sense. So I'm not stopping anybody from doing what they're doing now. If you want to get yours in the mail, that's fine. There's no problem with that. If it's an older lady, somebody needs that, that's great. But this just gives the patient choice. And they shouldn't be made to mandatorily go to a mail order pharmacy that the PBM owns. And by the way, I'll end with this. The 3 PBMs I mentioned, they're all owned by insurance companies. That's why your insurance brokers and insurance companies will call you and say, be against it. They own the PBMs. And with that, I guess I better have the clerk read House Committee Sub 1.